Bismillahirrahmanirrahim. Assalamu alaikum. My name is Muhammad Irfan, registration number 48, BS MLT, 8th semester student from Kohat University of Science and Technology. Today my presentation topic is fungal mycosis. Outline. Outline of my today presentation are introduction, types, causative agents, mode of transmission, epidemiology, symptoms, prevention, and lab diagnosis. Introduction of fungi. Fungi are eukaryotic organisms that include microorganisms such as yeast, molds, and mushrooms. They are classified as heterotrophs among the living organisms. Fungal mycosis. Disease or infection that are caused by fungi is known as fungal mycosis. Most common infection of fungal mycosis are occur on skin and nails. It may also cause infection in your mouth, throat, lungs, urinary tract, and many other parts of your body. Types of fungal mycosis. There are four different types of fungal mycosis. Number one, superficial mycosis. Number two, subcutaneous mycosis. Number three, systemic mycosis. Number four, opportunistic mycosis. Number one, superficial mycosis. Superficial mycosis, which is also known as cutaneous mycosis, that cause disease in nail, hair, and skin. Causative agent. Causative agent of superficial mycosis are dermatophytes, which are involved in superficial mycosis as they get keratin protein as a food from hairs, skin, and nails. Mode of transmission. Mode of transmission for superficial mycosis are direct contact with affected animal, contact with contaminated surfaces, using disease patient items such as razors, water glass, and other materials. Epidemiology. Superficial mycosis are common worldwide. They affect 20 to 25% of the population, and the incidence continue to increase. They are predominantly caused by dermatophytes, and the causative species vary with geographic region, such as Trichophyton saudensis in South Africa, Trichophyton violacum in Asia, and Trichophyton concentratium in East and India. Symptoms. Symptoms of superficial mycosis are loss of taste, pain on swallowing, soreness, redness, rashes on affected area, itching. Prevention. Prevention of superficial mycosis are keep your body hydrated, maintaining proper hygiene, keep your skin clean and dry. Lab diagnosis. Lab diagnosis of superficial mycosis are microscopic analysis, KOH test, potassium hydroxide test, culture method with the help of SDA media, calcofluor white stain, PCR technique, treatment on skin with alkaline solution. Number 2. Subcutaneous mycosis. Fungi that cause a disease under skin called subcutaneous mycosis. Subcutaneous mycosis is also known as second layer of clinical mycosis. Causative agent. Causative agent of subcutaneous mycosis are sporotrichosis and mycetoma. Mode of transmission. Mode of transmission for subcutaneous mycosis are skin is injured by contaminated objects such as stones, splinter, wood, or soil. People working in garden or in agricultural settings are more exposed to fungal spores or hyphae. Animal bites or scratches may also cause subcutaneous fungal mycosis. Epidemiology. Epidemiology of subcutaneous mycosis are more prevalent in developing countries, especially in rural areas. Young people 20 to 40 years of ages are mostly infected. Field workers such as farmers are mostly exposed to injury and trauma. Prevalence involved eumycetoma 40%, actinomycetoma 60%. Symptoms. Symptoms of subcutaneous mycosis are localized nodule, ulceration, granulomatous tissue, subcutaneous tumor with abscess. Prevention. Prevention of subcutaneous mycosis are practicing good hygiene, wearing air circulation clothes next to skin, keep your skin clean and dry. Lab diagnosis. Lab diagnosis of subcutaneous mycosis are identification of causative agent from the lesion with the help of potassium hydroxide, staining method, periodic acid chef, PAS technique, culture test with the help of HDA media. Number 3. Systemic mycosis. The type of fungal disease which affects more than one system of a body, such as respiratory tract, lungs, paranasal cavity, and guts. Causative agent. Systemic mycosis is mostly caused by dimorphic fungi, molds when present in environment, and yeast when present in human body. Mode of transmission. Mode of transmission for systemic mycosis are Inhalation of fungal spores that are present in soil or bird dropping may cause infection in lungs or in respiratory system. Direct infection through cuts or puncture wounds, vertical transmission from infected mothers to her fetus during pregnancy. Epidemiology. Epidemiology of systemic mycosis or histoplasma is found in area with bird or bat dropping, mostly occur in United States, Central and South America, South Africa, and some part of Asia. Coccidioidomycosis is endemic in western United States, particularly in the region of California, Arizona, New Mexico, Nevada, and some part of Central and South America. Blastomycosis is mostly found in Canada. Symptoms. Symptoms of systemic mycosis are fever, cough, chest pain, weight loss. Prevention. Prevention of systemic mycosis are regular hand wash, using antibiotics to control, monitoring patients in intensive care unit ICU. Lab diagnosis. Lab diagnosis of systemic mycosis are lungs biopsy with the help of hematoxylin and eosine stain, histopathology, microscopic study, blood culture test, serological test in which antibodies observed like IgG and IgM PCR test method. Number 4. Opportunistic mycosis. Opportunistic mycosis cause infection when fungi get an opportunity, especially in those people which have weak immune system. Causative agent. Causative agent of opportunistic mycosis are Candida albicans, Aspergillus, Cryptococcus, and Mucor. Mode of transmission. Mode of transmission for opportunistic mycosis are skin-to-skin contact with affected person, ingestion of fungal spores that may cause gastrointestinal infection, or by consuming contaminated food products such as grains or nuts. Indwelling medical devices such as catheters, central venous line, or prosthetic devices. These fungi can colonize on the surface of device and cause localized infection or enter through bloodstream. Epidemiology. Epidemiology of opportunistic mycosis are opportunistic fungal infection frequently reported in immunocompromised patients in United States due to aspergillosis. Brazil has significant prevalence of opportunistic mycosis in HIV/AIDS patients due to histoplasmosis. China has reported most cases of opportunistic mycosis due to environmental condition, population, and nosocomial infection. Symptoms. Symptoms of opportunistic mycosis are fever, cough with sputum production, oral thrush, vaginitis, rashes. Prevention. Prevention of opportunistic mycosis are get vaccination, intake of safe food, take medication on time. Lab diagnosis. Lab diagnosis of opportunistic mycosis are microscopy, urine UTI, vaginitis, and oral budding, gram staining from gram positive appearance, blood culture test with the help of SDR or PDA media. So this is all about my today presentation topic. Thank you.